Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukota Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
I'm Subuga John Bosco, and I'm the director here at Entebbe Regional Referral Hospital. Entebbe Regional Referral Hospital is one of the regional referral hospitals in Uganda, and we have health regions in the country, and for Entebbe we have been given what we are calling the South Central region as our catchment area. And this is a big area. It includes several districts, about 5 of them. It includes Wakiso, where the hospital is, Wakiso district, where the hospital is located. Then we have Nakaseke, we have Gomba, Butambala, Mpigi. But then also it is important to note that also the airport is a special place for us, because also for the travelers who go through the airport, if there is any emergency they need, if they have, or any medical care they need, they will always come to Entebbe Regional Referral Hospital. So that is generally the geographical coverage of the area that we serve. And then in that we have we serve a population of about 4.3 million people. Within this catchment population, within this catchment area, we have different facilities. Some are government facilities, hospitals, general health center 4s, health center 3s and 2s, but then others are private, not-for-profit institutions. Others are private for profit. So it is expected that for all those institutions, when they have any case that deserves to be referred, that requires specialized care, they should actually come to Entebbe Regional Referral Hospital. As a referral hospital, we offer specialized care for different or various conditions, but then we also offer many other services, mainly the clinical services, training services, but then also we offer research services. Under research services, we do, as you know, these days we practice what we call evidence-based medicine, and for that it requires that we do a lot of research. So as health workers, we do research with the doctors here, the staffs, the health workers, the nurses, laboratory, all these groups, they do research here, but then sometimes we also collaborate with other institutions to conduct research. With MRC, with the UVRI, with CPHL, with other universities, we do conduct research. But then also we are involved in training. We train students from other universities. We have some medical students who train with us here. Because of looking at the capacity that we have as a regional referral hospital, the human resource capacity, it is really something that we can use to really see that our people, the young people, we transfer all these skills to the young people such that they can serve the country better. So in that way we have several training schools. As I said, universities, some are medical students, some are nursing students, allied professionals, several of them are getting from different institutions. They are getting their training from here. And for us, this is really an important function, that service that we put in a lot of effort to be sure that this is properly done. But then most importantly is we offer clinical services. The clinical services, these are the different common service that we provide, and these are the main reasons why actually patients come to us. Clinical here, I mean the diseases we offer, we treat different conditions, and under these clinical services, some are curative services, some may be rehabilitative services, others are health promotion or disease preventive services. Sometimes what people prefer to call public health or community health related services, because we know these are also important. So coming to the hospital-based services, the clinical services, anyone who has any medical problem, any surgical problem, you can come to Entebbe Regional Referral Hospital and you get care. Here we have the facilities. The hospital has been enlarged. We have new structures in the hospital. We have the health workers. We have been on a campaign of recruiting more and more health workers for the hospital. In this financial year alone, we have recruited 67 new health workers. This cuts across all the different specialties. And then we have improved many of our services here, laboratory services, radiology services, as probably you will see. But all of this is to make sure that the people who come to our place, they find a good environment in which they find people and facilities which are ready to receive them and care for them. We provide, among the services, clinical services we provide, we provide, among the specialized services, sometimes we have what we call the intensive care unit. This is a ward or a unit where we take care of the very, very sick patients. It may be a woman, a child, a newborn, whatever, as long as you are very, very sick. We have this unit. You can now come to Entebbe and we provide this. I know already it is known that we have the ICU from the COVID time, but just to say, we still have this possibility. We have the doctors, the nurses, the specialists, anesthesiologists, the nurses, the doctors, and the whole team, which can provide this service. And for this, we must say that it's one of our strong points, because not many hospitals also provide this. So we have that particular service. But then, as I said, we are treating very sick patients, and some of them deserve to be given oxygen, especially those who may have problems with breathing, respiratory problems. Sometimes they need to be assisted with oxygen, and we provide oxygen. Good enough. In the past, as you know, we have come a long way when it comes to oxygen provision in some of our facilities. In the past, we would have to take cylinders to Kampala to have the cylinders refilled, and then they are brought back, they are used up, then we go back to Kampala to refill. But now we have an oxygen plant. Actually, we have 2 oxygen plants. We have one which we have had for almost like 6 years, and then we have a new one which has just been commissioned in January this year, a new one. And in this way, it gives us assurance that at least one of the most critical health supplies, which is oxygen, is always available, and we can give it to our patients. But looking at the capacity of the new oxygen plant, it is big. We don't benefit from this alone as a facility. Also, some other facilities from our catchment population, our catchment area, they can come and collect oxygen from Entebbe Regional Referral Hospital. So these are some of the key services that we are providing. But what we know is also when a patient comes, before a doctor makes a diagnosis, there is need to investigate the patient. And some of the investigations which are done may be laboratory related, where maybe we take off a sample from a patient, either blood, urine, stool, whatever sample. And this sample is taken to the laboratory, and we test and find out what could be the problem. that the patient is suffering. And it is important, it's good to let people to know that our laboratory is accredited has an international accreditation by the South African National Accreditation System. And this is very, very important, because it means that when you perform, to get this accreditation, we go through a very rigorous process. Actually, just yesterday, we had these auditors that they came from South Africa to audit our lab to see if we are maintaining the standard at which they expect us to be. So in this way, and we retained the accreditation. What the accreditation means is that if you have a test done from Entebbe Regional Referral Laboratory, that test, even if you go to any other part of the world and you show people that you have done a blood slide, a TB test, the blood test from Entebbe Regional Referral, there is no need to repeat it, because it is proven that by the time you received by the time the results are out, the sample has gone through all the required international procedures, and it is authentic. It is really taken as at that particular international standard. But then we also offer radiological services. Radiological, these include services like X-rays, ultrasound scan, and what is special at Entebbe, one of our specialized services is the CT scan. And the CT scan, this is a form of a highly specialized X-ray, which can help doctors to view, to see any minute, any small changes, any small abnormalities in the body. So those are some of the services we are providing. But then now we are, as a hospital, we are improving our patient record systems. And since last year in February, we are now having electronic medical records, such that when a patient comes, what this means is that when you come to our hospital, there is no need, all your records as a patient are going to be entered into a computer system, and then we remain with your record. So any other time you want to come back here, we already have your record with us. So there is no need to keep on moving with books and medical notes and whatever. We shall keep this with you. But then this one brings many other advantages. Not only keeping your record, but then it will translate into better care for you as a patient. So this is one of the systems that we are having. When you come, we give you a patient number, which you keep. This one you have to keep, so that when you return, we use that number to retrieve all the data, all the information about you. Then now we also have an integration, HIV integration service that we are implementing, such that any patient, if you have HIV/AIDS, if you have hypertension, diabetes, TB, all these chronic illnesses, we have established a chronic care clinic, such that if you have any of those conditions, you can come to the hospital. We give you care at any particular day. Between Monday to Friday, you come and you get care. But if it is an emergency that you have, of course, for that you can come anytime. Day, night, weekend, public holiday, you are welcome. But those who are already into clinical care, they can come. Between Monday and Friday, we have a chronic care clinic. And all of these are ways that as ministry, as the hospital, we are trying to see that we improve. They will help us improve on the care that we provide.
You are watching the Lens program. Stay tuned.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattresses suitable for institutions like hotels and many others for home comfort. With every piece telling a story of royal excellence, our products are built with the highest quality materials made to last. Experience royalty with Royal Foam Furniture, proudly made in Uganda, so buy Uganda and build Uganda. Visit our showrooms at Ginger Road, Chambogo Junction, Bukota Chisasi Road, and on Victoria Mall, Entebbe, on the first floor.
Welcome back from the break. This is the Lens program.
We have children maybe who have delayed to walk, who can't hear well, who can't see well. So all these kind of, who have speech problems, all these kind of babies or children. Actually now that is a very good clinic. This clinic, I like it because it is dealing with vulnerable people. It is a special clinic, and we are calling it the Sense Clinic. Sense Clinic. And with this clinic, we handle babies, children who are having any kind of developmental abnormalities. If they have any developmental delays, delay in their developmental milestones, we manage them in this case. So we have children maybe who have delayed to walk, who can't hear well, who can't see well. We can see them in this particular clinic. So it's a special clinic which really is. We are trying. We have a pediatrician. We have a pediatrician. We have a physiotherapist. We have a speech therapist. We have a clinical psychologist this is a team which manages, plus the nurses, and a nutritionist, because in some cases, if you may need to provide nutrition support to some of these. The causes of these problems are diverse, but the commonest cause is sometimes children may get severe forms of malaria, they may get severe forms of meningitis, which gets to their brain, and then the malaria is treated, it cures, the meningitis is treated, it cures, but then it leaves the brain damaged. So you'll find that some of these senses are lost, and this is why we have these diverse children having these diverse sensory deficits in the clinic.
You are watching the Lens program. Stay tuned.
Among the clinical services that the hospital provides is we manage epidemic. We have a national isolation center where some of these epidemics that we get into the country, the cases can be brought to our isolation unit, and then we manage them from there. So once in a while, when we have these epidemics, patients are brought to Entebbe. And one of the current epidemic that we are having, that is going on since July last year, is Mpox. And we have had, we are managing them from our National Isolation Unit. And then, of course, we are supported by government for this. The patients there require a lot of support, and we are getting the support from government for feeding, for supplies, medicines, many of these. And from government, we are getting support from Ministry of Health, and we have received some support under UCREP for medicine, for some supplies, for food, and for this as a hospital, we really, really appreciate this kind of support, because it goes a long way. Because when these patients come, they are admitted, they are isolated, and their attendants, they don't stay with their tenants. So it's a responsibility of government to take care of them. And it is through this project that we managed to access funds to cater for the issue of food. But as you know, food is a continuous need. So we keep on, they keep on supporting us for that one. Since 19th August last year, we had admitted about 2,362 patients. And at the moment, we have 36 patients admitted, with one child also admitted. But what we can say generally is that Mpox is a new disease. It is mainly spread by contact, skin to skin contact. But then we are also noting that it is spread a lot sexually. So when people have to be very careful in this way. So some of the measures that we had around COVID time, the handshaking and the other than body-to-body contacts, they have to be minimized. The hand washing, this one I must emphasize, becomes very key. And then also controlling our sexual behavior also will play a big role in reducing the transmission of Mpox. Usually patients, when they come, it comes in different forms. There are mild forms, there are moderate forms, there are severe forms, but then there are also critical forms. And patients normally will come with simple skin lesion, simple skin like pimples, a rash that they will have. For some, as I said, for the mild and moderate cases, these ones can be treated in several hospitals. Because now most health workers in the country, they have been sensitized. We have had several trainings on this, so it can be managed from a health center and actually from any health center. But then those who may have severe cases, they can go to any regional referral hospital in their area. In Uganda, you can be treated. But then for those who are from around Entebbe, when they will be referred to Entebbe, to our national isolation unit, and we manage them from here. Many times, whenever there is change, first of all, let alone being considering the chronic care, whenever there is change, there is always some, because people are uncertain of whether the change will be for good or for bad. So usually there is some people become anxious. But in this case, we need to there's something called change management. We need to manage the change appropriately. So what we have done in that way, before actually we had the integration. Before we had the integration, we had to sensitize the patients in the different clinics of what was going to happen. And of course, one of their concerns was the issue of the stigma that you have talked about. But then later, after all the discussions we had with them, they realized that actually what you think that is stigma is mainly in your mind. Usually the community, when it comes to, at least to the hospital services, when it comes to the hospital services, this issue of stigma, no need to get worried about it. People understood it and are actually coming for the care. And of course, a few may be a bit hesitant to come. But usually we know when they see, when we continue in this way, also those others will have to come. The key thing here is to make the patients understand that the care is for your health. For your health, and sometimes for the sake of the community that we are living in. And then what we think that is stigma, all of us, we have something around us. So we should also treat some of these other conditions, diabetes, hypertension, HIV, TB, in the same way. And sometimes also when people, colleagues, sometimes when the community or your brother gets to know, your mother gets to know that you have this condition, maybe they can actually even support you more in managing the condition you have. So stigma for me, for us, we don't look at it. Other people knowing a bit about your condition, we don't look at it in a way that it is bad, but actually it can have a lot of positive benefits for the people involved.
The LANS program was proudly brought to you by Atlas Industries Uganda Limited.
Step into a world of excellence, comfort and pride with Royal Foam Furniture, crafted to perfection right here in Uganda. We bring you state-of-the-art living room furniture and bedding products at affordable prices. Our wide variety of mattresses include orthopedic, pillow top, spring mattress